Good afternoon, everybody, and thank you, Kathy, for this wonderful introduction. And before I formally get into my remarks, I truly want to acknowledge all the wonderful work that our Dean, Kathy Matt, has been doing in health sciences. So many facets of it, the main campus on the green, the work that Kathy is doing, obviously, with Star Health, and I'll speak more about it later. And on top of it, this is super overload. She has been leading for 8 years the Delaware Health Science Alliance that now Omar Khan is succeeding her into. And so let's give Kathy Matt a hand. Please stand up. And of course, I want to thank all of you for being here today. My wife Eleni and I are so thrilled since this morning to see so many of our former friends and current friends, we hope, but also make new acquaintances because this is really a critical area that we all need to work together. And I would like to acknowledge in particular great work in community engagement that has been happening under the leadership of Dan Rich and Tony Allen. These two guys, the Twin Towers. Could you please stand up so we can recognize you? Both of you have done amazing work working with our former provost, Domenico Grasso, and now I hope that this excellent partnership will continue with our interim provost, Robin Morgan. Robin, could you also please stand up? So some of you, of course, know that Tony Allen has moved away from us from being a trustee and loyal person to UD to become one of our foes, at Delaware State. He's the provost there. But nonetheless, this is even more important because now we can all work together and we can practically own the entire state. So that is really good. So again, this has been a super productive conference. And there is more essential work that we need to do this afternoon. We appreciate your time, your energy, your commitment to improving the education and the health of our communities. The University of Delaware, you should know, shares your commitment because our most fundamental mission is to serve society through the creation and the dissemination of knowledge. We have a long tradition of excellence in teaching and research, and that tradition finds its highest purpose when it enriches lives, strengthens communities, and helps us create a better world. That's why UD devotes significant resources to improve the health and well-being of people in Delaware and beyond, and it all starts with education. Our researchers, our faculty, our staff, and students are exploring the relationships between community structures and the health of individuals. We're studying how social networks can help young people make good long-term choices about their health and education. And we're analyzing ways our state's Medicaid system can better respond to public health issues like diabetes, hepatitis C, asthma, sickle disease. And an upcoming study will investigate opioid abuse. And I really, really want to acknowledge and appreciate the wonderful leadership of Rita Landgraf as our former state secretary for health. Also at UD, we're preparing tomorrow's healthcare workforce and helping today's workers gain new skills to keep pace in the fast-changing field of medicine. Our faculty, staff, and students are working alongside community organizations and state agencies to build their capacity to address the most pressing healthcare needs. These initiatives are happening right here and now in every corner of the state and involve people everywhere around the university. For example, at UD's Star Campus, the great work that we are doing under Kathy's leadership with Star Health is bringing the community into our research labs and our healthcare clinics. Working with the community, we're treating Parkinson's disease today. We're preventing concussions. We're building better prosthetics. And we're improving the mobility of children and adults. And we're going to do so much more at the Star campus, as you know. Sometimes we joke we have one groundbreaking a week, but it's not far from the truth. A week ago, we broke ground on our biopharmaceutical innovation building. It's wonderful to see so many of you, including the senators and the congresswoman who were there with us that wonderful day. And at that BPI building, as we fondly call it, we are going to become a leader in the emerging field of biopharmaceuticals. Those drugs have the potential to treat the most vexing diseases, which include diabetes and autoimmune diseases and Parkinson's and Alzheimer's and cancer above all. So we're very excited about the innovation we'll bring both in the biopharmaceutical science, but more importantly in manufacturing, and bring them close to the healthcare providers where the patients need them. I can think of no better way to fulfill our mission of service than by applying our knowledge and discoveries to make people more educated and healthier. Of course, we can only achieve this if we work together. One of our guiding principles is that we must engage with the community at every opportunity and at all levels so that we fully understand what people need and how our work can positively impact their lives. This is our vision for UD's Community Engagement Initiative. By mobilizing and guiding the university resources, this initiative helps link our scholarship to action and extend our reach into the world. Later this year, the Community Engagement Initiative will release its civic action plan that describes our vision for strengthening the identity of the university as a true, engaged university. A critical element of this vision is the creation of strategic partnerships with the community. A year ago, we launched the Partnership for Public Education to help improve Delaware schools, especially those with low income and other at-risk students. Today, that partnership is working alongside school districts and education groups statewide, as well as the State Department of Education, to strengthen the teacher workforce and put UD research to work in Delaware classrooms. Together, we're making progress, and we're committed to continue the important work of the Partnership for Public Education. Indeed, we want to emulate the successful model of our education partnership and put it to work towards improving health and well-being of our state. So today, I'm thrilled and excited to announce that we are launching the new University of Delaware Partnership for Healthy Communities. Yes. This partnership will mobilize the university's extensive research, education, and public service efforts to address the complex health challenges facing communities in Delaware and across the nation, especially those marked by economic and social disadvantages. We'll build and strengthen partnerships with local and national institutions that share our vision of healthier neighborhoods, schools, and workplaces. Many of our partners are here today, and on behalf of the University of Delaware, let me say that we're grateful for your work and we look forward to collaborating with you. By focusing on the social, economic, and environmental conditions in our communities, I believe this partnership can promote not only better health outcomes, but true physical, mental, and social well-being for our residents. I believe the Partnership for Healthy Communities will make a significant impact on our entire state and become a model for our nation. We have some great people at the helm, and I'm confident that we will succeed to deliver our vision and make it a reality. The partnership will be led by Rita Landgraf, former Delaware Secretary for Health and Social Services, and now Professor of Practice in UD's College of Health Sciences. Erin Knight, Associate Director of UD's Center for Community Research and Service. Erin? And Noelle Sincere Duckworth, program coordinator for the Partnership for Healthy Communities. So let me now turn it with excitement to Rita to tell us the rest. Thank you, Rita.